Now we're going to talk a little bit about professionalism. In healthcare, our professional standards are pretty high. We are meeting with all different ages of patients. We're meeting with the elderly patients. We're meeting with babies who are just born. We're working with people who are expecting babies. So we have to be at our highest professional level so people learn to trust us. Here, I have Emily with me, and she is forwarding our personal protective equipment, which we abbreviate PPE, with our IV pole here. Okay. Maybe some of you have been listening to the news with the infectious diseases out there. Well, we have to take care of ourselves in healthcare. We have to dress professional, we have to show up on time for our shifts, and we have to make sure that we're keeping track of our schedules because we don't work just Monday through Friday. We work 24/7. The hospitals are open around the clock. Sometimes you're going to work overnights, which I've worked overnights before, and about 2 o'clock in the morning I do get a little tired. There's a little lag time, but then tend to pick up the pace a little bit more, and then in the morning I'm ready to go home. Sometimes I have trouble to get to sleep at night. Our night would be day for me when I worked an overnight shift, but we do it in healthcare. Some things that are nice about it, it does provide a little bit of flexibility. I've worked with some healthcare providers who work 12-hour shifts, and since they work 12-hour shifts, they just work 3 days a week, and that's all they work, and they really enjoy it. But you got to show up on time. Try to take care of yourself so that you do not become ill, even though we're exposed to all different types of patients who are ill. We have to have our immune systems at the highest level possible. But sometimes we do get ill, and we're making our immune system stronger. We need to stay home so that we don't get our patients ill. Call in advance. You want to make sure that you call your employer as soon as you know that you're ill and not going to be able to show up for your shift, because they're going to have to call somebody else in, and that takes time as well. We want to have professional presentation. Sometimes we dress in our scrubs. We want to make sure that our scrubs are professional, that we look nice for our patients, because they expect that. We also do dress in professional dress and business attire, depending on which department that we're working in. When you're dressing in your scrubs or your professional attire, you always want to make sure that you move around in your scrubs. I remember when I was a kid, my mom would buy me jeans, and she'd say, now sit down in them and make sure that they're comfortable. Well, I was like, why is she doing this? Why do I have to? I, as a nurse, have worked in some places in some awkward situations that I want to make sure that I don't have any back cleavage or front cleavage. Lean forward in your shirts or your scrub tops showing a little bit too much down below. We want to make sure that we don't have tattoos showing. We don't have piercings showing. Those are all things that people might consider to be unprofessional. In healthcare, we try to keep any tattoos or piercings out of the workplace. We also have to show initiative. So sometimes there's a job that needs to be done, and it might not be what we wanted to do, but we got to step up and say, hey, I'll do it. I'll take one for the team. And showing initiative is volunteering to do tasks that you might not have done previously before. Those are some of the things that we expect in healthcare. Sometimes you got to pick up for those shifts that maybe somebody became ill and they came open. We also have to show empathy for our patients. When we work with our patients, sometimes they're sad situations, and we don't always know exactly what they're going through. So we can't be sympathetic, but we have to have an understanding and know that their situation could be slightly different, and realize that it's a difficult time for them. Sometimes because it's a difficult time, we do get yelled at from family members or from patients. We always have to remember there's difficult situations, and that be supportive of our coworkers in those difficult times, be supportive of our patients, and not take it personally. We have to have cooperation. Teamwork is important. I don't know of a time in healthcare where, I don't even know of a career in healthcare that works independent of the team. It's becoming very fragmented. So we have, receptionists, we have people who work in billing. Those people might not like the hands-on bodily fluids as much as those of us who are nurses, or maybe even the surgical techs or invasive cardiovascular, because they're in that surgical type environment and exposed to a lot of bodily fluids. We use our protective garb for the bodily fluids, but we've got to work together. We have to be able to work with people, and sometimes there's conflict. We have to be able to work through the conflict. Now, a few other things that we do in health.